most of us have seen Alice in Wonderland, right? The first thing you notice is the visual experience that it gives you, which is overwhelming and sometimes even a little bit scary. Hi, my name is Emily Sesto, and today I will be raising awareness and informing you on the rare neurological disorder called Alice in Wonderland syndrome. First, let me explain what Alice in Wonderland syndrome is and what the symptoms entail. Pranesh Ravi, who wrote Alice in Wonderland syndrome in 2021, states that Alice in Wonderland syndrome was first put into writing by Lippmann in 1952. It is characterized by the impairment of time, sense, and body image, much like the book and the movie. The symptoms that characterize Alice in Wonderland syndrome consist of visual distortions, such as seeing things closer than they are or farther than they are, seeing things bigger than they are or smaller than they are, as well as the inability to perceive color and visual hallucinations. Now, these are just some of the few symptoms that characterize Alice in Wonderland syndrome. Over the past 60 years, Alice in Wonderland syndrome has been thought to include 42 visual symptoms and 16 non-visual symptoms, Blom 2016. This meaning that there is a massed group of symptoms used to bring together one syndrome, Alice in Wonderland syndrome. What exactly is the history behind Alice in Wonderland syndrome? The term Alice in Wonderland syndrome was originally used by a psychiatrist who resided in Britain, John Todd. He used this term to cover a group of symptoms. Now, Todd wasn't the first person to dissect these symptoms and try to clump them into one diagnosis. However, most of the dissection were categorized as hysteria, general neurology, or on soldiers with post-war wounds. Alice in Wonderland syndrome is exceedingly rare, and thought to be so that it is wildly underdiagnosed. Since 1955, only 169 cases of Alice in Wonderland syndrome have been reported and research published. It is theorized that these published cases are only a small portion of the syndrome itself. Now, what are the potential causes for Alice in Wonderland syndrome? Of the 169 cases, the potential causes vary exceedingly. The most common cause would be migraines, which is closely followed up by infectious disease. Looking back on these 169 cases, 38 of those are thought to be caused by infectious disease, 26 being the Epstein-Barr virus encephalitis. 51 of these cases are thought to be caused by neurological disorders, 45 of those being migraines. The causes for Alice in Wonderland syndrome vary, but they all tie back to one thing, the brain. Now, diagnosing Alice in Wonderland syndrome can be a hassle, so how do we do it? Diagnosing Alice in Wonderland syndrome is difficult. According to Jan Dirk Blom in 2016, as a consequence, in clinical practice, the diagnosis of Alice in Wonderland syndrome stands and falls with proper history taking, a thorough physical, and the sound knowledge of the many symptoms and causes of Alice in Wonderland syndrome. Due to the complexity, practitioners must eliminate the possibility that there could be another illness involved. How do we treat Alice in Wonderland syndrome? Does the patient ever recover? Alice in Wonderland syndrome cases are thought to be mostly benign, Sanchez 2018 says that most cases can end in complete remission with time and proper treatment. Which now brings us to, how do we properly treat Alice in Wonderland syndrome? It varies mostly on the cause. For example, certain medications can treat certain causes that would manifest these symptoms. The treatment must be used to treat the underlying reason that would cause the symptoms. A more specific example would be using a medication to treat migraines to alleviate the symptoms of Alice in Wonderland syndrome. Now let's go over what we've learned today. Learning about Alice in Wonderland syndrome has grown your awareness. We know that the syndrome is characterized by an overwhelmingly difficult set of symptoms. We know the causes and the means for the diagnosis. And most importantly, we know that it is the most difficult to obtain and understand. Due to the lack of research, we cannot fully compensate for what practitioners around the world are trying to gather. The awareness and understanding of Alice in Wonderland syndrome may cause more adults, teenagers, and children to come forward and release information and symptoms that they have experienced in the past. In consideration that one of the leading causes of Alice in Wonderland syndrome is viral infection, and we are in the middle of a worldwide pandemic, we need to recognize how vital awareness is. Alice in Wonderland syndrome is a rare syndrome that places its victims in a confusing, painful, and terrifying mindset. The lack of awareness can be detrimental to patients worldwide. And again, in this day and age, where an infection known as COVID-19 is and has been running rampant for 2 years now, we need awareness for this syndrome. Thank you.